This is the STL Medical Weight Loss radio show. With Dr. Joe, no more talking, let's go.
Welcome back to the STL Medical Weight Loss radio show. I'm your host, Dr. Joseph Moleski. I have my co-host here, Drew Shelton. And, we've talked a lot about various things today, but the one thing I wanted to bring up is something very interesting. I was on my flight back home from California, had my ear pods on, and I was just listening to some podcasts. I like to, get inspired and just listen to what other docs are doing and just hearing people's success stories on changing their diet, being on these medications, success stories and whatnot. And I came across a physician that she actually was diagnosed with multiple sclerosis. And multiple sclerosis is something that, can be really debilitating. It can cause issues with your swallow, your speech, your vision, your ability to walk.
Wow.
And over time, it's an autoimmune disease. It can really land you in a wheelchair and eventual death. And so what she was saying is she was on multiple drug altering medications, disease altering medications that were prescribed throughout the years that are approved for MS treatment. And over 5 years, she didn't see much improvement. And so what she decided to do is she started looking into cleaning up her diet, looking at how diet lifestyle change could help these neurodegenerative diseases. She actually published a book on it, and she went from almost the inability to swallow to now biking.
Wow.
And so the reason I bring that little story up is, your food and what you consume is so important to your health.
People don't even realize that.
Yes, it is so important. And, if you think that fatigue, migraines, sluggishness, obesity, and all this stuff is normal, it's not normal. Your body's trying to tell you something. Your body's trying to tell you, hey, I'm trying to give you a red flag, something's off. And what she goes into is she talks about for years, she noticed that she started getting migraines, she started getting this, she started getting all these different symptoms and couldn't put it together. And afterwards, after a long period of time of your body just sending you signals, finally it's okay, guess what? We're gonna create a disease for you because you're really not listening to me. And so I bring this up because it goes back to this patient being a physician, went through medical school, but in medical school we're not taught a lot about nutrition and nutritional guidance for our patients.
No.
We're taught how to prescribe medicines. And so what she was, she was I didn't have this knowledge. So she started diving into some of the, studies regarding how to change your diet and how to improve the overall level of inflammation in your body. There's a lot of inflammatory things that we can consume throughout our day, whether it's fried food or processed food or the high sugary foods. There's so many things that we consume, and over time you get this accumulative effect that it's going to cause disease or problems. Yeah. And so we've chatted about that quite frequently, but it goes back down to understanding how your body functions. So I'm going to get into some technical stuff, but I try to make it palatable for patients. So the mitochondria is it's your little generator in each cell. It provides the energy for your cell, okay? And so imagine if you were to short circuit the battery in each cell, that wouldn't be a good thing, would it?
No.
And then you could probably lead to disease, or just when a tool or whatever, a light runs out of batteries, things short circuit, things don't work, they don't turn on, they don't operate. And so when patients have high processed food and they're consuming the American diet, which is we're looking at about 100 grams of sugar a day, these little mitochondria, these little batteries, they short circuit. And then you have this lack of energy, and then people are slamming energy drinks, and then they're eating an hour later, and then they're craving foods and everything like that. And so what she talks about and what I've seen in my patients is when patients get on this medicine and then we give them the education, we start changing their habits, then they're not having that fatigue. They're more alert, they're more present with their family, they're more present at work, and then they have a clear mind. And the reason I see this, and it's in the some of the research, is that when you're on a diet that you don't have to rely on sugar to get your energy, and you're relying on these protein bars, or you're relying on these energy drinks or whatever it may be, and you start eating like whole foods, like vegetables, and you start eating not processed meats, you're starting to shop on the outskirts of the grocery store, not in the interior, staying away from the processed foods, you actually are decreasing the inflammation in your total body and even your brain.
Wow.
And so when I heard about this physician developing MS, it really struck me as like, wow, like if that happened to her, I don't have MS, but if that happened to her, could that happen to anybody?
Well, sure.
And obviously there's some genetic factors there that, hey, I'm not saying everybody that eats a bad, eats let's say a processed diet is going to develop that, but it just goes to show like, hey, we need to be cognizant, we need to be aware of what we're putting in our bodies, because it could have long-term side effects and problems.
You don't know what you don't know.
Yeah.
And to have this program out there now that we are seeing the results that can change your life, that can change the course of your life and prevent that from happening in the future potentially, and have these miracle cases. I want to call this a miracle. Had they not been on this,
or changed up their diet, it's one of those things where I feel like if you think of your body as like a high performing vehicle, and say the outside looks great and whatnot, but you're not putting in the right fuel, over time that outside is going to get damaged and you're not going to be able to go as far. And you got to have the right energy and the right vessel. They both have to work together. You got to be putting in that health, that you got to be putting health into your body. If you're putting junk in, don't expect to get really anything out of it. And so these medications, they work as tools. We've talked about this, but they work as tools for you to make those right decisions, reduce your food cravings, slow down your digestion to make you feel fuller longer, and then they work in your liver and pancreas to help jumpstart your metabolism by reducing insulin resistance and liver fat.
3 months for me, 35 pounds down. We've talked a couple case studies earlier.
Yep.
We know people that have been on this program for a few months and they're up to 40 and 50 pounds down.
Yep.
It is a huge deal, and there's a price tag to it, but you know what? There's a price tag to everything.
Yep.
And it's worth the price tag if you want to change your life.
And figuring out, how is that going to change all the other aspects of your life is key. And then the last thing I would like to talk about, I've talked about this in other segments. Now, these are just like in the research. I followed the research. This is not a published thing. It's not, this is approved for this, but there was a study that they're looking at these medications being GLP-1 agonists. You can look it up online, like Ozempic, semaglutide. They are possibly a natural anti-cancer defense mechanism.
Crazy.
Yeah, so they're helping with, there's research that they might help with like autoimmune diseases, Alzheimer's disease, and even help people beat cancer.
I'm for that.
Yeah, my thought is if it helps you lose weight, decreases inflammation, low levels of chronic inflammation can lead to cancer. So imagine you're reversing the inflammation, you might improve.
Yeah, look at what you're doing now to prevent what could happen in the future.
Yep.
Invest in you.
Yeah, invest in you. And here at STL Med, we are committed to your success. We're committed to you, achieving long-term results, and just we are passionate about helping you in every aspect of your life. And so for more information, I really encourage all of our listeners to book an appointment at stlmedweightloss.com. That's the easiest way to start. There's a $49 consult fee that secures your appointment in line, and then we take that $49 off if you decide to sign up with us. And then you can also reach out at any time, 636-628-6604, and we can get you on the schedule. But we're always happy to help, and take the chance, invest in you.